What is what are some of the things that you can do as an organization or as a leader? What kind of processes can you put in place that kind of, I guess, maybe prevent people, going in the downward spiral? Or what are some of the things that you've seen or maybe have suggested to organizations to keep people on the good side of the ledger in terms of well-being?
Right. So I want to start by talking about things to do in the middle of a disaster response and recovery,
Okay, yeah.
because that's where we're at, right? So one of the most important things we can do is regular and predictable and caring communication to our teams. So it's help. So one of my staff people had described my communication over this time as a 4P model or a 3P model, and then I added a fourth. So she said that my communication had been personal. So I use I statements and I talk about you instead of the employee, right? So I don't use third person, I use first person. And also as part of that personal, I'm comfortable with this, but I talked about days when I was struggling. Emotional responses in a disaster tend to be a bit of a roller coaster that is not triggered necessarily by anything externally that we can identify except the disaster. So we'll have good days in a disaster, and we'll have days when we think the world is falling apart. And I was able to let our staff know when I was having some bad days and when I was having good days. And I was able to say to them, that's part of the normal response. So that personal aspect to communication is really important. Pastoral is the second P that our staff person identified, and that's a sense of caring. So communicate to your team that you care about them. Again, that needs to be legitimate. If you fake that in a disaster response, our bullshit meters are on high alert. So don't pretend, but if you do legitimately care about your team, let them know that. Personal, pastoral, and practical. Make sure you've got information in your communications that people can instantly do something with and that impact their safety, and make sure that information is accurate. So we, from the beginning of the response, said all the information we were going to get to staff was going to come from BC's provincial health officer, so Dr. Bonnie Henry and her team. And they knew they could trust that, right? They work in healthcare. They have a sense that that's a trustworthy source. The P that I added was predictable. So we told our staff at the beginning of this response that we were going to communicate with them around 2 o'clock every day. And I did miss a couple of days because of meetings, but for the most part, we got an email out at or about 2 o'clock every day that updated them on our response, that updated them on the pandemic in general, and that updated them on the latest safety information. One of the things in a disaster, and it's been very true in this pandemic, is that our understanding of what's happening changes rapidly. And it's not that it was wrong before, it's we have more information now. And so we did that. Now, we've identified that we're now at a plateau in our response. So last week in our email communications to staff, we said, we think we're at a plateau. We're going to go from next week. So we foreshadowed it. Next week, we're going to go from daily to twice a week. But we reserve the right to go back to daily if everything starts changing all the time again. So again, and that was about keeping it predictable. So, it's not that you can't change how often or when you communicate, but make sure you flag for people when that change is going to happen so that if it doesn't happen, they don't go, oh my God, what happened to Michael? Is he in the hospital with COVID-19? Right? Because humans' brains often go to the worst case scenario really quickly. Or is our organization going bankrupt because we didn't get the email on time? Like, those are very normal reactions to a very abnormal situation. And so the more we can keep something predictable, the more we'll be helping our staff.